The adult heart has no ability to repair itself following injury, so heart muscle cells are highly sensitive to blood flow and oxygen, and when there's a blockage to the coronary artery, heart muscle cells rapidly die. In fact, a human heart can lose billions of heart muscle cells within a few hours of a myocardial infarction. And the heart has no way to rejuvenate or regenerate itself following injury. So one of our major interests is to try to devise new strategies for creating new heart muscle cells in an injured heart as a strategy for regeneration. Right now, these are early basic science proof of concept studies in animals, primarily in rodents, and we're using a variety of approaches. The ones we're testing mainly would require surgical intervention at the moment to turn one cell type into another cell type. The cell type we're focused on is a cell type called a fibroblast. This is a cell that makes a scar tissue and prevents the heart from contracting. And we're working to discover recipes of genes and drugs that can turn a fibroblast into a heart muscle cell. The next step is to optimize this method for cardiac reprogramming in rodents. We're working hard to do that right now, as are many other laboratories. I would say within the next year or so, those studies could move into larger animals, perhaps a pig model for heart disease, but then it would be several years after that before it would move into humans. So it's still quite a ways away. We're really at the early stage of basic science. I think this would be an option for individuals who have had a cardiac event, and perhaps at the time that they would present at the emergency room, some of these new regenerative therapies could be applied to their hearts early in the process of heart disease. This is a whole new area of biology called regenerative science and medicine. We're trying to apply it to the heart, which is clearly one of the most fascinating tissues in our body and the least regenerative. But many of the principles and approaches that are being applied to regenerating the heart could be applied to many other tissues, including the kidney, components of the nervous system, and other tissues as well.